This is One on One. We are honored to be joined by Dr. Stephen Brower, Medical Director, Left Court Family Cancer Treatment and Wellness Center, and Patrica Mazolla, who is Advanced Practice Genetics Nurse, Englewood Hospital Medical Center. Good to see both of you.
Good to see
Thank you, Steve.
Are you ready for this? I think it was 2.5 years ago. I'm on a tour with Warren Geller, right? Your CEO, of this facility that you're gonna have. This is it. I was walking through, I saw concrete, I saw, what are they gonna have here? This is it. Describe what it is.
Well, if you're walking there today, Steve, you'd see thousands of patients, and you'd see patients every day being in an incredibly beautiful, compassionate center where we bring together all this expertise under one roof. So patients are not moving around from doctor to doctor, from expert to expert. They're within one group, and we're trying to make their odyssey through this whole cancer experience, you know, so much more sensitive.
And personal. I mean, that's the other part of it that's fascinating to me. So personalized medicine, quote, tumors are not all the same.
Right.
What does that mean?
Well, I just want to do a little bit about personalized versus precision medicine. So years ago, we used to say personalized medicine, and people thought, well, they're directing it towards that particular person. Now it's really talking about the effectiveness of treatment, how we treat the cancers, and taking the whole person in context of what their disease is.
Genetics as well?
Certainly,
What's the
genetics
connection between
is
genetics?
huge.
Okay, you're diagnosed with a particular form of cancer. Your genetics, your genetic testing that you do. What does that have to do with how you treat the patient?
A lot. It has a lot to do, and it gets more and more all the time. So we're looking at if you were diagnosed with breast cancer.
Right.
So we're looking at your family history, your personal history, the type of tumor that you have, the biomarkers, and Dr. Brower will talk more about the
Jump
tumor
in there
markers.
because all those factors matter, those variables matter in the protocol.
So let's peel it back for a second, Steve. You know, when I entered into cancer treatment 30 years ago, I would never have dreamed that we could examine the proteins and the DNA within a cell to more precisely define for each patient prevention, perhaps, treatment and therapy, and then survivorship. As you're living and being treated, how we can make it better for that patient. And now today, this precision medicine means we look at the precise abnormalities within that patient's tumor and then turn that into a formula for personalized medicine. So like over the past year, we've introduced 20, 30 new drugs to treat patients that are just based on these abnormalities that we're finding in these cells.
But let me ask you a follow-up on that. In terms of radiation, chemotherapy, can you be more targeted in how you go at it as opposed to treating the whole body?
Absolutely. In fact, there are some tests that we do, oncotype, tumor suppressor genes, to actually identify whether a person needs chemotherapy or not. It used to be 25 years ago, if you were diagnosed with breast cancer, this is the treatment. And
for everyone?
For everyone. There was very little discussion and leeway. Now, each time a patient is diagnosed, we talk about different things that may affect not only how they're treated, but the outcomes and everything that's included in, you know, managing a patient.
Steve, I want to tell you two exciting things that when you and I first were even walking around our cancer center a year and a half, 2 years ago, didn't even exist. Number one, it used to be thought of surgery, radiation therapy, chemotherapy.
That's the protocol. That was the protocol.
That was the protocol. Now today, after 100 years of slow incremental progress, we now talk of a new player, and that's the immune system. That's how you or I, as the host, interact with the tumor.
Interact with the tumor?
Interact. Exactly. The cells of the immune system recognize this tumor as foreign. And now we have new medications that can boost it, that can help the immune system to really hone in on these tumors. So that now, when we think about treatment, as I said, we've introduced 20 more medications that weren't even available to patients. And the most important thing is they're to treat tumors that were the hardest ones to treat originally. Lung cancer, bladder cancer, kidney cancer, head and neck cancer.
More reason to be hopeful?
Much more reason to be hopeful.
You say yes as well?
Oh, for sure. There's so much more reason to be hopeful that some of the worst prognostic cancers are being treated with all these innovative treatments, these targeted treatments, and they're doing really well.
So this genetic testing, is it for everyone?
Yes, it is for everyone. It's an interesting question because initially we used to think...
Excuse me for interrupting, a lot of people say, no, not me. You say?
I say yes. It's because it's not, all genetic testing isn't for everyone. And that the importance of counseling that person as to the implications for that testing, not only for them, but for their family. So yes, it is for everyone to know about.
Is it private? Does it stay private? You're both shaking your head.
Yes.
Totally confidential here, right?
There's actually the GENE Act, which is the Genetic Information Act that prevents anybody from knowing what your genetic makeup is.
So Steve, cancer genetics, and Pat is the expert on this, have initiated and been around now for 10 years, I guess, with breast cancer and the tremendous... Right. So we've learned a lot about confidentiality.
That's right.
What it means when you have to tell not only the patient but their family this news. And that's why we, not only within our cancer center and with all the important cancer centers, not only have the people doing radiation therapy, surgery, chemotherapy, we have these experts as well.
And by the way, you're only one of 56 nurses with your area of expertise?
Right. In the
country.
In the country. There's 3 actually in Englewood.
Is that right?
We really made a push for that. But it's interesting that you said we actually
Half a minute left. Go ahead.
Have a cancer risk assessment and genetics counseling program. It's not a genetics program. It's actually a cancer risk assessment. So it's people to come from anywhere, all over, to really evaluate their cancer risk. People talk about cancer prevention, and I don't know how much prevention we can do, but we can certainly find out more how to live healthier lives.
A few seconds left. Reason to be hopeful is?
So first of all, by the numbers, Steve. A decade ago, maybe 1 or 2 patients who had cancer lived more than 5 years. Today, more than 2 of 3, 2/3 of the patients are alive after the 5 years. So that's great news and hope. The other piece is we're finding new ways to look at these genetics. So hopefully, in the not-too-distant future, you can actually take a sample of blood and look at the abnormalities that a patient's tumor may have without these invasive biopsies. So a lot of things coming along.
Reason to be hopeful, but much more research. And we want to thank you for joining us. Make sure you come back and give us the update in about a year or so. We appreciate it.
Thank you.
Good stuff going on at your place.
Thank you.
1-on-1, 1-on-2 right now. Be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Choose New Jersey, Fedway Associates, Verizon, TD Bank, Johnson & Johnson, the Russell Berry Foundation, and by the New Jersey Education Association. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with TriStar Studios.